Welcome to The Kick, your expert-led podcast helping you explore and learn everything about getting pregnant, pregnancy, birth and becoming a parent.
On the podcast and our online pregnancy program, Grow My Baby, we share my experience of helping more than 4,000 babies to be born.
And our experience of running a women's health clinic and parenting 4 boys.
We're here to help everyone to feel empowered in pregnancy and birth with real-life practical information.
Welcome everyone, I'm Brigid Maloney, and today we're covering a topic that we've had lots of people over the years ask us to do. It's a topic about fear of childbirth, and it's got a name. It's called tocophobia, and it's a very specific issue, condition, and diagnosis. And we've found someone who has a lot of expertise in this area, and we've invited her on to the show. So we've got Rebecca Wheeler. She is a clinical psychologist with over 25 years of experience. She has a strong focus on the emotional journey of parenting, from contemplating conception through pregnancy and birth to the ongoing realities of raising children. She is a consultant at Westmead Private Hospital, where she works alongside maternity, obstetric and paediatric teams, and she's been running her own private practice in psychology for over 2 decades. As we talk, you might hear the odd ambulance in the background, as Rebecca is recording from Westmead Hospital. I hope you get a lot out of this conversation. And even those that fear childbirth but perhaps don't have the intense fear that surrounds tocophobia, I think this is an episode that everybody will get something from. All right, let's get on with the show. Welcome, Rebecca. It's so great to have you here.
Thanks, Brigid. It's great to be here.
Yeah. It's a topic that we have been asked about again and again, and fear in childbirth. I don't know, is it something that we don't really want to talk about because it's just something that we should be okay with? Or how often are your clients coming in with that as a problem?
I agree that it's something that we don't always want to talk about because we think it's, well, to a certain degree, it is normal. Of course, having anxiety and worry in childbirth and pregnancy is really normal. But this extra layer is very different. And I do talk about it all the time with my clients, but this extra layer of fear is a less common, it's more common than you think, I guess, but it's still not the extent of this sort of fear, this tocophobia, as we'll talk about, is much more extreme than standard anxiety and worry in pregnancy.
So I'm assuming, Rebecca, that somebody's picked up this episode because maybe they already feel a little bit of anxiety around birth.
Sure.
And they're feeling that anxiety right now as they're listening to us. What are some simple strategies somebody could do to feel ready to listen to this episode?
Okay. I think, to be honest, to take a breath to start with, which I know sounds really simplistic, because of course, when we are talking about fear of childbirth, and if somebody really does have that extreme fear, any of these conversations can be activating for them. So actually just taking a moment to pause, to take a breath, just to know that actually what we'll be talking about will actually hopefully give them a much better understanding of what's happening for them and what they'll be able to do to help manage these fears. So I think that's actually really important. And it's really important to actually talk about this for them and for them to know it's okay for them to hear and listen to this, that none of what we're going to talk about is going to harm them as such. Is that these are, that's right. These are just words they can listen to. And actually, if it gets too much for them, they can just press pause, walk away, come back when they need to and listen to some more.
Because there's layers of worries and fears, aren't there, when it comes to
absolutely.
childbirth? Can you maybe talk our listeners through what is sort of the common worries that people have and when we might be bordering more onto fear or, as we're going to talk about in a minute, that tocophobia?
Yeah. Look, worries tend to be more fluid and flexible. They come and go. They sit in our thoughts. They're not necessarily rigid and fixed. And certainly, again, about pregnancy and childbirth, they're really normal to have. So we would expect somebody to have worries around pregnancy and childbirth. But fear is rigid, it's intrusive, it's visceral, it's based in the body more so than the mind. You know, there might be thoughts that feel associated with that fear, but actually the fear really sits in the body.
Yeah, right.
So yeah, there's a real difference between the presentation. Fear is much more extreme, I guess.
Yeah. And when it is
Yeah.
extreme, we've got a word for that, which is tocophobia. Can you please define that and tell us more about what that actually means?
Okay. So tocophobia is the fear, dread, terror of childbirth and pregnancy. It's actually a Greek word. It's an unusual word. It's based in Greek origins, like many of our words. Tokos meaning childbirth, phobia, fear. But it's not just when I think about it clinically with people I work with, it's not just childbirth itself, because it really shows up in the process of pregnancy as well.
So people can have a fear of even becoming pregnant?
Absolutely. Absolutely. Even though they want to become pregnant, they really want to become pregnant, they want to have a child. Well, they don't necessarily want to become pregnant. They want to have the child. But they can really have that fear of pregnancy as well.
And when someone comes to you as a client, what are some of the very common things like that people could recognize in themselves when they're listening to this podcast?
So common things in terms of general, like what most women would experience around pregnancy and childbirth, they're going to have a range of worries around that. Am I ready? Will I actually get pregnant? Of course, there's all those fears around how quickly will this happen? When I get pregnant, will I be ready for that? You've got those baby-related worries. Will baby be okay? Will I be okay? How will I afford this? What will I do with work, maternity leave? They're the standard things, right, that, we would expect. How do I stay well? What do I eat, et cetera? And so we're kind of thinking that that's just standard stuff that women are going to experience. And we don't want to just because they're standard, we don't want to dismiss any of those worries, of course, but we just see those as the everyday experience of worries. It's the fear that, again, we'll step into another layer of that one. But these are the things that I would expect. Also, actually, what kind of birth will I have if we step into that childbirth space? What kind of birth will I have? Am I going to have a vaginal birth? Will I have a C-section? Will I cope with birth? How much will it hurt? Sounds like an obvious comment, of course, but really, again, how much will this really hurt? Can I cope with this? Because there is that sense of, I don't know if I can cope with this experience there. And how will I be postpartum, of course, the recovery and baby and relationship and so forth.
And defining tocophobia, how different is someone who you would say, okay, well, this is a diagnosis that's beyond the normal common worries and fear. We're now going to talk about this thing called tocophobia. What happens? What's the tick over that you go, okay, this is where we're at?
It's interesting because people can talk about similar fears with tocophobia, but on a much more extreme level. It's there. So it really is the intensity of some of those fears that they will talk about. If we think about how that shows up, I will have women who are desperately frightened of getting pregnant. Again, even though they want to be that way, they might use multiple layers of contraception. They may not be able to have unprotected sex. Having unprotected sex can bring terror, like literally a visceral bodily terror inside them, again, even though they want to conceive. It can show up with nightmares, intrusions, sleeplessness, panic attacks, fixations on thinking constantly about pregnancy and childbirth, avoidance of that. I don't want to talk about it. I can't think about it. I don't want to go to my antenatal appointments. When people are expressing joy and excitement to them, they don't want to know. They don't know how to respond to those answers. It's a real repulsion of that excitement that other people might experience.
And I mean, gosh, that opens up in a whole other thing I hadn't thought about before, and that is how do people interact with someone that has this really big fear of childbirth? Because most of us go about and think, childbirth, that is means to an end in a way. That this is a process, and how I cope with it, how I cope with other, say, medical issues or whatever. But this fear must be so difficult for everybody around them as well, including maybe a partner.
Absolutely. It can be really hard for a partner because, often they have had discussions together that they want to move to this next stage and have a family. They want to have a child and partner may say, yeah, great, this is what we want to do. But prospective mum here is caught between wanting to feel the joy of where their partner is at, but actually feeling this dread and fear and terror. And the partner doesn't know how to respond to that. Do I just say, come on, let's get on with it and have a baby? And what's your problem, essentially? This is what all women do, versus needing to actually be really understanding and supportive. And I've been really fortunate. In fact, I think the vast majority of women I've worked with tocophobia have actually had really supportive partners. And whether they're just the ones that have come through my door, so to speak, I'm sure there are some that would find it hard. And I do believe if they haven't experienced anxiety or something like that themselves, it might be hard for them to wrap their head around, but ultimately be able to get to that space where you know, okay, I don't get it, but this is really big for you. And so I'm going to have to support you with that. It's essential.
How common is it?
The numbers vary. In Australia, they estimate between 2.5% and 14% of women would experience tocophobia, but we don't really know how accurate that is. I think it's really underreported for some of the reasons of it's not well understood, and there's shame and embarrassment in talking about that. I don't think clinicians even recognise it's necessarily falling into that range of tocophobia versus just a woman who's feeling a bit apprehensive. It's just under-researched as well.
Yeah.
Overseas, they put the rates sometimes at much higher, but here in Australia, this is where we've pegged it at the 2.5% to 14%.
But even 14% is like, if that is a realistic number, that's a massive amount.
Absolutely.
Yeah. Wow.
Yeah, absolutely.
So when you talk about diagnosis and who and why it doesn't get diagnosed, who is doing the diagnosis?
Mainly clinicians, psychologists, GPs, obstetricians, psychiatrists, midwives, even. But diagnosis, I would still say, is a loose term when it comes to tocophobia because they're not necessarily knowing how to diagnose. There are some psychometric assessments, but really they're not used commonly in a clinical purpose. They're more research oriented. So most people wouldn't even refer or know about those. I would have a lot of women referred to me for simply feeling anxious.
Yes.
And it's only once I meet them and start talking with them that I actually will assess the real severity of that anxiety. Certainly sometimes the initial referrer is aware that this is quite an extreme form of anxiety, but they won't realise it as tocophobia.
And are there levels of tocophobia? Like, could you have a phobia about having an epidural, for example, and that was really the only thing that you feared in childbirth? Or would that still come under that sort of class as being tocophobic?
So it depends on, it's a good question, and it really depends on the severity of that. There are levels within tocophobia, certainly, but I'm not sure we would set such specific levels. At its base, it does sit amongst an anxiety disorder, I guess, and so like any anxiety disorder, there's a spectrum of presentations there. We do have a couple of subcategories, I guess, that we would think of sort of primary tocophobia and secondary tocophobia. Primary being that tocophobia before a woman has even conceived or had a pregnancy, had baby. And often that tocophobia develops actually much, much earlier before they're even considering having a family. Some people will describe feeling this terror even in adolescence when they start, everybody starts talking about, when you grow up, you're going to have a baby, blah, blah. And they might notice those feelings beginning then. For others, of course, it's later. Secondary tocophobia is after you've experienced a pregnancy and birth. And so often it is associated with, quite likely, your experience of birth then.
Right.
In that reason. But within all of that, there's still that range from lower level to extreme. If somebody was just really frightened, and I wouldn't say just as if that's nothing, of course, but if they're fearful of, say, an epidural, it's much more specific and doesn't necessarily have the layers that sit behind a tocophobic presentation, I guess.
Yeah, right.
So it certainly may be a fear, but it may not actually be a true sort of tocophobic presentation.
That's very interesting because I know, just from being in our clinic and hearing people, like I often chat to our pregnant women, and a lot of them are really fearful of needles. That seems to be a very common fear. But
Sure.
again, from what you've just said, that doesn't necessarily mean that's tocophobia. Or, it's a
No,
very defined fear.
it is. Tocophobia is much more layered and complex. There are many reasons, I guess, that can sit underneath that. And so I'd be cautious to say a single fear like that would be the true tocophobia. It's still a fear and still something that can be managed. It may be a phobia of needles. I remember absolutely not wanting to have an epidural in my first pregnancy or birth because I was just, I don't know, I didn't want, actually all I heard about was the headache that can come afterwards if it doesn't happen correctly. And I thought I'd actually had a bit of a challenging pregnancy. And I thought, I want to get to this birth and just have the best time afterwards. I do not want to have the possibility. Now, of course, I realize now that that's not as common. But that might have been a fear and apprehension of mine, but was certainly not a tocophobia presentation.
Want to feel good more often in 2026? Hi, we're here for you. Move by Mamma Mia helps you fit movement into your everyday, giving you more of me time whenever you need it. From strength and cardio to yoga and Pilates, with workout plans that fit every space, every body, and whether you've got 10 minutes or 40. Start 2026 with enjoyable movement from just $9.99 a month. Mamma Mia subscribers get unlimited access. Head to move.mamamia.com.au and use MoveMe to get $20 off an annual subscription.
For people that perhaps do have tocophobia, I just heard the ambulance because you're at a hospital.
Sorry. I know. I apologise. I've got 3 hospitals outside my window.
So, Rebecca, when it comes to someone getting tocophobia, is there other underlying risk factors for those people?
Yes, there can be many. The development, I guess there's a number of factors that essentially increase somebody's vulnerability to tocophobia and developing a tocophobic presentation. But it's really important to say that not any of these on their own are causative. So anxiety and mood disorders can be part of that picture. Tocophobia, as I've said, sits within that broader anxiety space. For many people, that anxiety will absolutely not go on to develop tocophobia. It's just not as simple as 1 + 1 = 2. Things like a person's sense of control, how comfortable they feel with uncertainty or discomfort plays a really important role, actually. Their relational and attachment history is relevant, their relationship with their own body, their values, beliefs around parenting, experiences of trauma. They're really important to consider, actually. Sexual trauma, medical trauma, previously distressing birth, experiences of loss, perinatal loss, miscarriage, stillbirth, neonatal death. They're significant experiences, of course, that can really influence somebody's experience, particularly of secondary tocophobia there. Or, of course, even if they've not experienced that themselves, they might fear that in their initial experiences. Support systems, if somebody is really unsupported, if they don't have a significant sort of village around them, they need to feel emotionally held and supported. Partners, caregivers, the community. I've actually worked with clients where their own birth was experienced by their mother as distressing. And so they've heard the stories of their birth. Or, as strangely as this might sound, they actually have a felt sense of that birth that still sits within their body, really on a cellular level. I've had many women I've worked with that have this absolute undercurrent of fear, and they really have no sense of where that's coming from until we actually start to experience it. We start to explore, their birth, and of course they're going on their memories, or not their memories, sorry, their mother's memories generally, or their family members' memories. But they have this overriding sense of, just this visceral sense of something could happen. And we do know that things sit in our cellular memory, really, and activate that in our body and our emotions. So it's a layered picture: biological, psychological, relational. Somebody's attachment and relationship history is also, of course, really important. So we want to try to understand all of those things when I'm working with somebody.
God, that is a lot to unpack. And like if I look at our community and our society, any person listening to this could pick out one or two things. And
that's right. That's exactly right. Which is why it's important to say not any of those things, they're not causative.
Yeah.
We're looking at a multifactored complex layer that sits there of trying to understand how each thing weaves into another. And somebody might be listening to this actually, Brigid, and say, well, I haven't experienced any of those things, but I'm still experiencing tocophobia. That's okay. We just want to understand where their experience comes from and what it looks like for them.
Yeah. I wondered if it's okay for you to relate perhaps what like a patient a client has said to you about what a typical day looks like for them coming into childbirth, or even thinking about becoming pregnant.
Yeah, good question. We can look at that in two levels. There's the clinical, a clinical presentation that we look for. So clinical symptomology, really, if I'm being clinical about it now. And that can be hard to really fully capture it. I think clinical language doesn't really fully capture it. But I will hear things like, we'll look for things like panic around pregnancy or birth when it's discussed, constant dread, nightmares, catastrophic thinking, intrusive images, enormously strong physical anxiety within their body, hyperarousal, sleep disruption, reassurance seeking, distress, all those things. But again, they sound sterile, and that's what I, as a clinician, will look for, and I might write in my report as such. But what we want to think about is, yes, how does it show up every day? It's the avoidance of pregnancy. It's the avoidance of sex. It's the multi-layered of contraception, as I think I mentioned before. I've had women that are using multiple forms of contraception and they are still testing for pregnancy every day, just in case they're pregnant, even though they're using contraception. It is the constant talking about it with their partners. Can I do this? What will this be like for me? They feel exhaustion. They feel isolated. They feel a sense of, loneliness because people don't understand this. They feel shame for feeling tocophobia. Society doesn't expect women to experience such intense fear around childbirth.
So, Rebecca, do these people realise that their fear is more than their friends? They do.
Really good question. They do, but I think it takes time, to be honest. At first, I think they just think there's something wrong with them and they must be exaggerating their experience compared to other women. So I don't think they necessarily realise, gosh, what's wrong with me that I'm overreacting in this way? Because everybody is apprehensive about pregnancy. And of course, everybody should be apprehensive about pregnancy and childbirth to a degree. I mean, once upon a time, it was the most dangerous thing that we could do. And that's where this fear at its origin really sits from. This is a primal reflex in us to avoid something that's ultimately incredibly dangerous. Back in generations upon generations ago, when it really was medically dangerous to be having a baby. Now, of course, nowhere near that experience. And sure, we know things happen, of course, and we don't want to minimize that, but it's a well-managed experience now. So I think I've sidetracked there for you, Brigid. Sorry, because you explaining that sort of fear response is actually quite important as to where that comes from and why it becomes this fear rather than just this anxiety. So there's this normal apprehension. So women think, I've just got this apprehension like everybody else. What's wrong with me that I feel it in this way? and they don't talk about it. I saw somebody the other day who had no idea, and they sort of just been talking with everybody, and they were thinking, what's wrong with me? Because my friends are feeling apprehensive as well about this, but why am I throwing up even before I'm pregnant at the thought of being pregnant as such? What is wrong with me that I'm having this experience? So it's really as they start to talk about it and think about it more, and then perhaps talk to hopefully their medical practitioners, they realise, okay, something's different. My worries are bigger.
Mm. And you've talked a little bit about people avoiding getting pregnant and the doubling up on contraception. Do people also choose to have a permanent solution to contraception because of the fear of tocophobia?
Yes, they do. They do. I've really had people make a conscious decision that they will not go down the path of having children because of fear, or they will use those permanent contraception methods. There are some women, and it's obviously hard to think of it in this way, but it is not uncommon at all for somebody with extreme tocophobia to actually interrupt or disrupt their pregnancies when they've become pregnant, having terminations and so forth, even when it's a very planned pregnancy and a wanted pregnancy. Sometimes, to be honest, even when it's an IVF pregnancy, which is as planned as you can get, really. And that can bring enormous guilt and shame, these mixed feelings of relief, then guilt and shame afterwards. And it's never a decision that's made lightly. It's not something to be talked about lightly, of course. And that just shows the level of real terror that somebody can be experiencing.
I want to get on to, because I'm feeling anxious right now. I want to get on to, now we've diagnosed it, what happens next? Like how does this treatment path go?
Okay, really good question. And that's the one that I actually love talking about because, well, it's what I get to do every day is do that sort of work. First of all, I think somebody choosing the right care team for them, if let's say they are pregnant already, they really, or actually in fact, even if they're not, I've had many people go on and choose their prospective care team before they're pregnant. And that is then really, that's really helpful to have a psychologically informed GP, obstetrician, an obstetrician that has great midwives that perhaps working antenatally with them, enlisting their support, their sort of family and friend support team, of course, is really important as well. So those things and getting those in place is important to start with. But in terms of clinically, what we can do, and it is because I hear what you're saying is you feeling anxious hearing about this because we're talking about terror and somebody's terror, their dread, and that can absolutely be activating. But it's so important to say is that this can very much be managed and supported. And I've worked with so many beautiful women that have gone on to have their babies and just had this wonderful experience, actually, in fact.
That's so good to hear.
Yeah. I am, it would be wrong to say constantly amazed because I've seen it so often. I shouldn't be. But I guess because I can see where they start with this place of intense terror, that it's just so wonderful to see when they're holding their babies in their arms actually and smiling, because really this is not about having their baby. This is not about holding their baby for the first time. This is not about bringing their baby home. That is something they want to do. It is the pregnancy and the childbirth. So when you see a woman holding their baby at the end of this process, it's quite wonderful. But what does treatment look like? Okay, a number of things. I think, first of all, it's really important to explore their experiences. We've been saying we want to understand those layers that's there, what shaped their fear, what's maintaining it, what meaning it holds for them. There are practical strategies that we can look at managing things like intrusive imagery, reducing that physiological arousal, working with panic. There are strategies such as, modalities that we use, CBT, which is acceptance and commitment therapy, can be really useful there. When there's trauma involved, whether that's a previous birth or medical experiences, earlier life experience, even completely unrelated to birth or pregnancy. Yes, talk therapy, EMDR, that's in relation to trauma and specifically and anxiety. So that can be really helpful. If there's a loss, we want to support that experience of grief. That's really essential. But it's not about strategies. I guess strategies will help and they're very, very useful. But it's not as simple as applying a few strategies and someone would be able to work this through. I tend to work much more from a relational lens. So really understanding the person in context, their history, their relationship with their body, with themselves, with their family, their sense of safety, how all of that is shaping their experiences there. It's not just, it's probably really important to set realistic expectations that it's not just a few sessions of learning techniques. It's really building a deeper level of safety and trust between myself and a client, between them, their family, their caregivers, and often that will span the course of their pregnancy. I've worked with many people leading up to pregnancy for months, sometimes leading up to pregnancy, then during their pregnancy, leading up to birth. As I said, enlisting a supportive caregiving team, really, really important there.
Quick question. Are you tired of the news? Do you want a podcast that isn't self-improvement? Come get unleashed. It's funny.
I also think that underwear is sort of almost like a new marriage. Like it starts off, it gives you the best of what it offers at the beginning.
It's unhinged.
I have a bit of a thing for my friend's husband's salami.
Oh, hello.
It's not here to teach you anything.
I need to make sure he looks at me. One side, I'm going to make a sign. This is what I married because I didn't meet you in time.
Yeah, right.
The other side, with pointing to my son who's 12, look what we could have had, Lewis.
Yeah, I love it.
It's a good time for Gen X. So search Unleashed wherever you get your podcasts. New episodes every Tuesday.
And once the baby's born, what does the mum feel about the birth then and the bonding that, if there's any bonding issues with the baby?
Really, really, really important question, actually. And one that we talk about carefully, actually. As I said before, that this is not a fear of having a baby, themselves bringing a baby home. This is the fear of pregnancy and childbirth. However, tocophobia can have an impact on that mother-baby attachment, but it really doesn't have to. And that's the bit I really want to specify. It doesn't have to. The bond between a mother and a baby is complex, and it doesn't happen in a single moment after birth. It develops over time, during pregnancy, and across that postpartum period. Not even in just those first few hours, days, or weeks. It develops in months, really, following birth. We talk about growing the baby. We grow our baby in our belly and in our mind. We grow a concept of ourselves as mother throughout the pregnancy and again in that early postpartum experience. From an attachment perspective, what matters is not perfection, but the ongoing relationship, a caregiver's capacity to notice, respond, and repair actually over time. And there are many protective factors, there are many influencing factors that are there. So we want to be mindful and offer support and know that it can have an impact, but it doesn't have to. That's so important to say. So many of the mothers I've worked with have got this wonderful, amazing, deep connection with their baby. And so I want every mother out there or potential mother who's experiencing tocophobia to know that this does not have to define their parenting experience.
And you mentioned, that it's not perfect, this mother-bond relationship. And perfection is a big problem, I think, with mothers in general. And I don't know whether you've got any comment on it, but whether it's more apparent in younger generations because, they have perfection shown to them all the time with social media. And I just feel the pressure to be
absolutely
perfect.
There is the pressure to do everything perfect now. And I think underlying, not all of tocophobia, but a chunk of that is this desire to be in control of everything. a difficulty sitting with the discomfort of being uncomfortable. We avoid any discomfort now. We are constantly scrolling to avoid discomfort. We are researching to avoid discomfort. We have these perfect images presented to us, these Instagram photos and images of mothers just beaming through their pregnancy and having no issues whatsoever. But of course, we know that that's not the full experience. That is just one moment that is captured in that photo rather than a whole woman's experience. So working on that deeper societal level of challenging perfection and that desire, parenting is, it's just, in fact, perfection is damaging in parenting. It really is. It's a big word to use, but we are setting our children up if we are trying to be perfect. That does not teach them about the world and life. So we know beautiful relationships and wonderfully resilient, strong, healthy children are raised with what we call lots of ruptures and repairs, where things go wrong and an attuned parent can step in and repair from those moments and continue to support their child.
At the very start, I just want to pick up on that sometimes it might be actually the stories that we hear about our own birth and the glee that feels like some mums talk to their kids about how their babies were born, including my own mother. How can we be better at that? Like, it can be a trauma for the woman who wants to relate it to someone. How can we do it meaningfully to that child so we're not also causing issues for them?
Such an important issue that you raise there. How can we talk respectfully about birth stories? How can we share? I think society, humankind, actually, we communicate through stories, don't we? Stories have passed down through generations, and that's an important part of community, in fact. But there is sometimes this glee of, let me tell you what happened to me. And that can very much be traumatizing to a woman. So we actually just want to talk. Sure, we might, first of all, we want to actually ask whether somebody wants to hear stories around childbirth. We want to say, would this be helpful to hear or not? We want to tone down our language when we're talking about that. We want to be mindful of our audience. Who are you talking to? I think an interesting point actually is this very important birth trauma inquiry that's been happening, of course, over these last couple of years. And of course, we've really wanted to raise awareness in birth trauma and work out what we do to support that. There is a flip side to that, is that what women are hearing all the time is birth trauma, birth trauma, birth trauma, and hearing these women's experiences or how it's reported in the media more than anything. And so they're hearing, this is what birth is like. Birth is just traumatic. But actually, whilst birth is absolutely challenging, and we are doing something that, well, unless we've done it before, we have not experienced before as such, it does not have to be the trauma that we assume it could be. In fact, I had one mum I worked with for many months leading up to her pregnancy. She was experiencing significant tocophobia, and throughout her pregnancy. And she was going really well. That was fantastic. And then I spoke to her. She actually delivered just slightly early, very marginally early. And I spoke to her obstetrician afterwards, and she rang me and she said, "Oh, Rebecca, she had a really medically traumatic birth. Like, it all happened. And really, mum and bub were well, but it all happened." And I sat there and went, "Oh my goodness, I've just spent all this time. What's going to happen?" In fact, that mum was not traumatized at all following that birth. And when I spoke to her about it, her care team, they were amazing. They kept her informed. They talked with her. They reassured her. They were compassionate, empathic, and attuned to her. She had a sense of what was going on. She had a say. So we don't want to assume.
No.
So,
That's our big thing too, with even from the listeners that call in. And so through our speak pipe, people will call in and ask questions. And a lot of the time they'll go through the list of things that happened in their birth. And Pat and I will be thinking, "Oh, wow, this sounds really traumatic." And I'll say, "But because I had tooting our own horn here, because I had
Yes.
listened to this episode and I'd done this and I'd done the
Sure.
program and I knew exactly what
That's
was
right.
coming. And at the end of the day, that didn't feel traumatic. And I just
No.
think, I think getting good information,
Absolutely.
unbiased, and the breadth of knowledge, because I think actually so many times we do take on board the knowledge that we want to hear. So
Yes,
we'll only
yes.
listen to the birth stories that match our own hope for our birth. So
That's right.
That's what our hope is that people have a breadth of knowledge that they can take into birth and hopefully.
And I think, to be honest, I think you do that really well. My kids are well in their 20s now, so I respectfully don't generally listen to your podcast purely because I'm not at the point of conception and pregnancy. That ship sailed for me. However, in preparation for doing this today, I thought I really want to sit there and, I knew of your podcast certainly, but I haven't listened. So I'm going to sit here and listen. And I heard your episode recently with Jessie, who delivered her twins, of course. And I loved what I really loved from a clinical perspective with how you discussed that. There's a whole recipe that could have been quite traumatic. It may have been, not wanting to predispose anything there, but the way you and Pat spoke about that and actually just paused and broke that apart medically in just a grounded way versus, oh my gosh, this happened and this happened and this happened. That is the respectful way we need to talk about it. That actually reduces, we want to ground those stories and reduce that fear in that regard and say, okay, things can go wrong sometimes, things can be really big, but actually they can be managed and they can be dealt with.
I have loved this talk with you, Rebecca, and we could go on, but I do want to finish with my last question, which is, if someone's listened to this podcast and thought, actually, no, my fears feel the same as we've been talking about, what should they do?
Tell somebody to start with. I know that's obvious to say, but really, they need to just talk with somebody. Maybe it's their partner to actually, to start with, tell them how much this is bothering them, what fears really sit there. Talk to their GP. If they are already pregnant, talk to their obstetrician or midwife. So that's the first step, is tell somebody, even if you just use gentle language like, I'm having these worries, but they feel bigger. They feel bigger. And I'd like to talk with somebody about that. Finding, of course, I'm always going to suggest talking to a psychologist because that's what I do. But talking to a perinatally trained psychologist, actually, that's really important, because whilst this is a form of anxiety, it's a very specific, it is not a simple phobia. I know we were chatting on another day, you asked me the question around arachnophobia and
is it the same thing as arachnophobia?
That's right. And
the phobia that we know.
Exactly. And it's sure, it's a phobia, but it is much more complex and layered, as we've been talking about. So you actually want to talk with somebody that's really perinatally trained in that way. There is a great organisation, the Centre for Perinatal Psychology, which is nationwide. And that's really great. You can jump on them. They've got a list of psychologists. I'm certainly affiliated with them, just to disclose that. But they have clinicians in each state that really are perinatally trained, and that's, as I said, that's important. COPE, Gidget, Panda, they're all organisations that can step in and provide that perinatal support as well. Getting support early. I've certainly had women come to me in the last few weeks of their pregnancy. That's tricky. So we want to try to work as early as we can with somebody to support that experience.
Great. All right. Well, we'll put all those links in our show notes so people can go, okay, well, let's flick there. And if you're lucky enough to be in Westmead, is that where you are? Westmead?
Well, my main clinic's at Beecroft, actually, but I do consulting out here at Westmead. So it's just where I am today, surrounded, as you said, by multiple hospitals. I don't think there's been too many ambulances. A couple, but not too many today. They're pretty good.
Yeah,
That's
good.
right. Oh, telehealth. There's always telehealth.
Yeah.
In fact, I have lots of people in South Australia for some reason that I'm seeing at the moment. So
Yeah, well, it's
the way
like
it works.
sometimes it's very difficult to get the right person, and that you pointed that out.
Mm.
It has to be somebody that's perinatally trained, but it's also
Trained.
someone who you get
Mm.
on with as well, and who you feel like, yeah,
Yeah. That's
you're gonna
actually the
have.
critical bit. Thank you
Mm.
for raising that. And gosh, of course, that doesn't need to be me. Whoever it is that you see, because this is a relational experience, you need to build that relationship, that appropriate clinical relationship with whoever is your caregiver, including your obstetrician or midwife or GP, I think, but certainly psychology. You want to build that sense of safety and trust so that you can be vulnerable with them and really explore this with them. That's what will help you.
Yeah, perfect.
Yeah.
All right. Well, thank you so much for joining us, Rebecca. Wonderful.
My pleasure. Thanks, Brigid. It's been great.
Thank you. Thank you, everyone, for listening to our conversation with Rebecca Wheeler. Rebecca did mention lots of different resources for people, and we'll put those obviously in the show notes. So to get to the show notes, for those that don't know, you go into either your Spotify or iTunes or wherever you're listening to this podcast, and it'll all be there in written form. You can just click on the links. While you're there, we would love a review. 5 stars. If you think 5 stars is warranted, we would be very grateful. It helps to push our podcast out to other listeners so they can also get the informed information that you guys are getting. And that's what we want for everybody, to have a really informed pregnancy and birth. All right, everyone, until next week, we'll be back in your ears. So have a really good week and good luck growing those babies. Bye for now. Hey, even though Dr. Pat is, well, a doctor, and we get lots of other doctors and other experts on our podcast, I just need to remind you that this podcast is for informational purposes only. We share lots of medical insights and experience, but everything we talk about is general in nature and may not apply to your specific situation. Please always consult with your own healthcare provider for your individual medical advice when you grow your baby.
It's Monday morning and your mind is already racing.
And you're replaying an awkward conversation you had during the week. Your inbox is full, your patience is gone, and life just feels like a lot.
I'm Ashani Dante, and alongside with clinical psychologist Dr. Anastasia Horonis, we're here to help you unpack the messy, honest stuff that keeps you up at night.
And this is But Are You Happy? The Mamma Mia podcast where we skip the fluff and dive into the real talk you actually need.
This is the mental health podcast you and all your friends need. Listen to But Are You Happy Now, wherever you get your podcasts.